Great. Thanks everyone for joining us today. My name is Victor Orozco, a senior economist at the World Bank's Development Impact Evaluation Department, or DIME. I lead the multi-sector research program on entertainment education, the use of entertainment media with development objectives. As motivation for our session, a recent World Bank report concluded that while adaptive software had a lot of potential in improving learning outcomes when hardware and other inputs were already present in schools, the provision of hardware alone, from laptops to tablets, was not a good investment when not accompanied by well thought out complementary measures. Can social and behavior change communications be a missing component for the latter EdTech approach? This session is composed by two parts. In the first part, researchers will present causal evidence of the impact of behavior change campaigns delivered through television, radio, social media, and community events in improving human development outcomes, including education. Our researchers include Rachel Glennerster from the University of Chicago and former chief economist of the UK's FCDO, who will present findings from a randomized controlled trial of a radio campaign in Burkina Faso on gender and sexual health outcomes. Ericka Rascon-Ramirez from Middlesex University, London, who will present results of a trial that targeted 6 to 9-year-old children and their parents in northern Nigeria, and that combined aspirational movies with the provision of smartphones preloaded with literacy apps. And Nandan from the Universitat Autònoma de Barcelona, who will present work on the use of social media ads for effectively micro-targeting groups of interest. In the second part of our session, we will hear from producers and implementers who will discuss tips on how to scale up social behavior change communications for EdTech based on leading global examples in the space of gender, health, and education. This panel will include Poonam Muttreja from Population Foundation of India, who will discuss creating awareness at scale through multimedia campaigns. Regan Alsup from Impacted International, who will present interesting work linking behavior change communications with in-school instruction approaches. And Oluwakemi Akagwu from Johns Hopkins Center for Communication Programs, who will present some of the nuts and bolts of how this leading organization is designing toolkits for policymakers for designing, implementing, and hiring behavior change campaigns in public health. So, lots to learn from researchers and producers. Let me start off the research part with evidence from television. Through a large-scale randomized controlled trial in Nigeria, we tested the effectiveness of the third season of MTV Shuga on HIV and gender-based violence outcomes. That season lasted 3 hours, and study participants were not exposed to other HIV or GBV information, so we could only study the effects of this television show. 8 months after watching the show, we see impacts not only on knowledge and attitudes, but also on behaviors. This show alone doubled HIV testing and halved sexual concurrency, chlamydia infections, and physical violence. These effects were driven by program immersion and character identification, mechanisms very unique to engaging narratives. Closer to our audience interest, a recent study of Sesame Street shows its high cost effectiveness for educational outcomes in the US, exploiting variation across cohorts and counties in children's exposure to television broadcasts. This study found improvements in academic progress in elementary school, with impacts particularly pronounced for boys, minority children, and children living in poor neighborhoods. The show accomplished school preparedness objectives at a cost of only $5 per child per year. Okay, over to our panelists now. We will start with Rachel, followed by Ericka and Nandan. Over to you, Rachel.
Thanks. And as the slides come up, I just give you an background. I'm going to present the results of a randomized trial in Burkina Faso, looking at the impact of a mass media campaign on contraceptive use, and also the impact of just exposing people to mass media by providing them access to a radio. So we both look at a particular campaign and at mass media in general. So if we go to the next slide, this is joint with Joanna Murray and Victor Pulaquin. So you know, just a little bit of background on the context and motivation. We see, you know, high fertility in low growth countries is really changing the geography of poverty. And in particular, by 2030, 85% of people living in extreme poverty will be in sub-Saharan Africa. If you just click through all the bullets on this, thanks. And 25% of women in sub-Saharan Africa report unmet need for contraception. Now, a lot of the quasi-experimental evidence suggests that simply having access to mass media can reduce contraception, and it's likely to be, as all people have hypothesized, it's because of the difference in kind of the lifestyles of the people that people see on mass media versus their own lifestyle. The people you see on mass media tend to have smaller families. Now, there's another literature of sort of behavior change RCTs that really focus on the kind of the specifics of what makes good mass media. And that is, you know, providing, increasing the salience of a message. So even if people know it already, increasing salience can have an important role. Providing information where beliefs are different from reality. And edutainment, as we've heard from Victor, there's some studies on that, saying that people engage more and understand more and react more to messages that are entertaining. Now, Burkina Faso is an extremely poor country with very high fertility rates. 68% of people have a radio. There's very little TV, so this is kind of the way to get to people. Now, very few people listen to the national radio station because it's in French, and very few people in rural areas know French. So instead, people are relying on these community radios that broadcast in local languages and have very defined broadcast areas. Because they don't have much money, they mainly play music. They, you know, give the messages that it's sensitization programs, you know, say, oh, can you tell us, you know, can you say these messages? So they'll have, you know, they'll talk about the government messaging on family planning. They'll also have call-in shows because those are pretty cheap. So next slide. So this is our study. We randomized both by radio station level. So there are 16 radio stations with very distinct coverage in Burkina Faso, and 8 are randomized to get the campaign from DMI, which is this, you know, very serious NGO that sort of, you know, has a lot of media background, thinks a lot about how you frame messages. So they are working with 8 of the radio stations randomly chosen. And then within each radio station area, we give some women a radio who didn't have a radio before. So that allows us to pick up the effect. We have 2 different ways of picking up the effect of the program by looking at women in the radio station areas that got this campaign, but also comparing the women who got a radio or didn't get a radio in treatment areas. And then we can look at the effect of just having a radio on women who didn't have a radio before by comparing women who got radios and didn't in control areas. So next slide. So I think it's important to, you know, the quality of the message matters a lot. So I'll just spend a minute on, you know, what DMI was actually doing. They have a saturation approach. So they had 10 spots a day, 3 phone-in shows a week with a community health worker so that people could ask, there was a knowledgeable person you could ask questions of, it was in local languages. They spent a lot of time, literally all their team spent time in villages understanding what the concerns were before they developed the content. You have 2.5 years of programming, and it's all designed around the potential barriers. And the campaign represents about 4% of total radio content, but more like 20% of peak listening time content. Next slide. So we have 3 sources of data. We survey women, we get data, we survey clinics to find out whether women are coming for family planning, and we have the administrative data, which shows the distribution of all contraception in these areas. So next slide. So again, we're kind of triangulating from many different approaches. So first of all, the campaign worked in the sense that people listened to the radio. The women who received radios spent about double the amount of exposure to mass media. And so their weekly time spent listening to the radio went from about 1.3 to 3 hours. Next slide. So the results. In non-campaign areas, simply getting a radio led to a fall in contraceptive use. This is really at odds with what other people have found in the literature. And we think it's because these community radio stations aren't really presenting a different lifestyle. They're about the local community. And some of the more conservative actors in the community are quite vocal on these radio stations. Can you click to the next one?
You have 1 minute.
In campaign areas, getting a radio led to a 5.9 percentage point increase in the use of contraception. Click again. And if we just compare the radio station areas that got the campaign versus didn't, you see nearly 6 percentage point increase amongst all women in the use of contraception in areas covered by the radio campaign. And if you just look at women who had a radio at baseline, that's 7.6 percentage point increase in the use of contraception. So this campaign is having massive impacts on the use of contraception, but simply getting a radio actually is negative. Next slide. So I'm just going to talk a little bit about the mechanisms. I said, I think the issue of why getting a radio in control areas had a negative effect on contraception is, you know, in these calling shows, people would call in and share, you know, misinformation, and the radio station really didn't have the ability to kind of counter that because they weren't experts. And this has all come out of, you know, qualitative research with the radio stations. Why did the information campaign work? It provided information. It was really designed around what we know about what works, right? So it counted misperceptions. We see a big decline in the number of people who think that contraception could cause sterilization or have negative side effects. It came from trusted voices of local health workers, and it was done in a very entertaining way. So this was, you know, this was a high quality. It didn't change preferences. What it did was it made women who were already using contraception a certain amount use it much more regularly. So I think this is a more general message that sometimes we can try and focus information campaigns on the people who are at the edge, at the border, you know, can be easily changed. Rather than really trying to change these deep-seated preferences, it can just, you know, address misinformation and get the people who are kind of on the margin to go over the margin. Last slide. Oh, yes, and we have some, cost effectiveness. Let me just say one word about cost effectiveness, because the benefit of mass media is you know, it's very cheap. So we get, you know, the radio station campaign, if you just look at the pilot, is an annual cost per woman of $48 per extra woman using contraception. If you click to the end, you will see that that cost comes way down when they scaled this up. So this program has been scaled up to the whole of the rest of Burkina Faso. So we have actual data on costs. And if you assume the same impact, the annual cost per extra woman reached is $8 per additional woman using contraception, which is, compared to the rest of the literature, fantastically low. So I'm going to stop there. You can bring down my slides, and apologies for going over.
Thanks so much, Rachel. To all participants, if you could kindly write down your names in the chat and the organization you're joining us from, as well as any questions you have. We'll have a Q&A session at the end of all presentations today. So now over to you, Ericka, please.
Thanks, Victor, for this invitation. And also thank you for the collaboration in the last 3 years in this project. I also thank the Nigerian Federal Ministry of Education, as well as the World Bank and NORAD for their financial support in these 3 years. Let me begin with just providing some background about Nigeria. Currently, we have around 10.5 million children out of school. And even those children that are attending a school are not learning much. And this is not new about Nigeria. We also know in other countries that this is happening. To give an example, around 44% of third-year primary school children in Kano, Northwest Nigeria, give no correct answer whatsoever in letter recognition, which is the first level of literacy. And around 83% of them give no correct answer whatsoever in reading comprehension, which is the maximum level of literacy that we can achieve. In addition, we also observe that early marriage is common. It's a common practice. And just to give an idea about how much is this, around 68% of teenage girls in Northwest Nigeria are already married before turning 18 years old. So the question is, what can we do about this? And we have two main ideas here. First, we aim at increasing aspirations of parents. And second, we provide children with learning technology to learn at home. We tested these ideas in Kano and Jigawa, where the Sharia law fully implemented. And we designed a cluster randomized control trial with two interventions. The first treatment was based on aspirational movies. So we invited parents to attend 2 sessions in 2 weekends of aspirational movies that were compounded by documentaries and animated stories. Whereas treatment 2, in addition to exposing these parents to aspirational movies, we also provided a mobile phone that had preloaded mobile learning apps. We also have a control group, and in total, we had around 128 school catchment areas, of which half of them were randomly allocated to the control and the other half were allocated to treatment 1 or treatment 2. We have 9,300 households in total in this trial, for which the main target was a child between 6 to 9 years old per household. Both interventions were based on social psychology theories, where in the aspirational movies, we tried to expand the opportunities that parents were perceiving about the future for their children through these videos.
Yes, I can.
In addition, their treatment that was complementing these aspirational movies with mobile apps, we aim at teaching at the right level and at the right pace to the child at home.
I'm terribly sorry I didn't hear that.
I briefly give a selection of our findings. Number one, what we observe with the aspirational movies is that we increase parental aspirations in favor of future schooling attendance for daughters, as well as we saw a decrease in parental aspirations in favor of early marriage. We observe a decrease by 40% in the number of out-of-school children.
Presenter and you speaking at the same time.
Sorry, can you please mute your microphone? Thanks. In addition, the treatment 2, which is the aspirational movies with mobile phones, what we observe is that there's an increase in parental perceptions about how the parents perceive their own capability to help to learn at home, despite of the level of education that they have. Our parents were 50% of them with no education whatsoever. So this is a very important psychological measure that we observe here. But in addition, we observe a large impact on literacy and numeracy skills. For literacy skills, if we look at an aggregated measure, we observe a 0.18 standard deviation increase in literacy skills and a 0.33 standard deviation in numeracy skills. These are pretty large impacts. In addition, in this treatment that was complementing the aspirational movies with mobile learning apps, what we observed is spillovers for siblings, literacy and numeracy, of the magnitude of what we observe for the target child of 6 to 9 years old. And we also observe a decrease in teenage childbearing of the magnitude of 13%. Let me just conclude this presentation with the following messages. What we learned with these two interventions is that we must consider in future interventions that are having similar objectives to know how parents perceive the future of their children, because we know that these perceptions about the future of their children have large impacts on present investments in human capital. But in addition to that, we believe that it has been underlooked how much these technological tools not only help to improve the skills at home, and of course that increases the labor market opportunities of children in the future, but also these technological tools improve the levels of empowerment of family members. And just to say where we are heading after these interventions, if we get further financial support, we would like to go back to the same rural communities and measure long-term impacts on learning, early marriage for not only the target child, but also again for the adolescent siblings, as well as we would like to extend our work using this type of aspirational videos and using technological tools on teenagers to empower them and also to change school and adolescent early marriage or early childbearing. Thank you, Victor.
Thanks, Ericka. Very interesting results. Nandan, over to you.
Thank you. Can everybody hear me?
Yes.
Excellent. So as Victor mentioned, I'm really going to talk about how we can utilize the power of Facebook's and digital advertising in general's micro-targeting for development outcomes to target the populations we care about. And I'll explain a little bit about some of the evidence, how that worked in a previous study we did related to malaria, but also in a study that we were planning, which is related to education and very much in line with what Ericka just presented, where we're testing a lot of the same literacy apps that she showed results for and showing how we can go online with them. So what is the opportunity? The opportunity is that a lot of people have a smartphone, right? And the opportunity here is that a lot of people are connected to the internet. That means there's an opportunity that there's a lot of people we can reach with digital ads, with online ads. Of course, there's also a problem or concern, which is that, well, those that don't have a smartphone or those that aren't connected actually tend to be the focus of our development outcomes, our development efforts. And so this leads to a concern, right? Can we use social media campaigns for development work? Is it a useful tool? Because this is a reality, right? What that concern really says is that social media is biased both towards rich countries, towards higher income countries, and rich people, right? These sort of lower income countries that we might be interested in, or lower income people, are less represented on this platform, and that's a bias. But the reality is that a bias is an old school statistical problem, and we have an old school statistical solution to dealing with bias, which is stratification. And what becomes really interesting is that we have a really new school solution or new school way to stratify, given these digital ad campaigns. And this is this sort of massive machinery that these companies have built up to micro-target and to target certain segments of the population. And while this machinery was originally built up to sell people things and target people most likely to buy things, we can actually use it to target anyone. For example, to target the target population that we're interested in and measure the effects that our campaigns, our interventions are having directly on our population of interest. So an example of how we did this, and this is a study with Malaria No More, along with Facebook and Upswell, where what we did is, first we found that malaria actually affects primarily, or affects more, let's say, those people in mud, straw, and tin houses compared to those people in concrete and brick houses. And this is in line with previous literature. Hopefully you can see that this is both a proxy for income, as well as a direct danger of malaria, mosquitoes coming in, et cetera. So this is sort of an at-risk population that we cared about, that we were interested in. What happens? Well, when we go out on Facebook and try and recruit people to take a survey and to measure impacts of our campaign, of this social media campaign, those people are actually less likely to answer our ads, right? They're less likely to be measured by us, to interact with us, because they're less prevalent on these social media platforms, right? There's a bias against people in mud, straw, and tin houses on these platforms. So what we did is we took, again, this sort of ad targeting machinery, and we told Facebook, target people in these kinds of houses. Of course, that was an explicit option given to us, but we could take a bunch of these respondents that we had that live in these housebook, and we told Facebook, give us more people like these. And that allowed us a way to increase the representation of those individuals so that we had a balanced group. Once we had a balanced group, we could measure the impacts on both groups, right? People that lived in mud, straw, and tin houses, people that lived in concrete and brick houses. And what we find is that actually our ad campaigns have the ability to change behavior in both groups. We found that in both groups, their likelihood of sleeping under mosquito nets was increased to an equal amount. But what do we also find? We also find that if you run a naive social media campaign and you just go out in the whole country, in the whole world, and you try and run a campaign, you're actually mostly going to reach those in concrete and brick houses. And so this is really important, right? Because what we're saying is that, yes, there is a bias. That's very much true. That's very much the reality. But actually, there are these really interesting, really powerful tools that can help us directly combat that bias. And so what do we think about education and literacy? So what this might be within this literacy world is saying, okay, we're interested in the impact of apps, but maybe we're concerned that these apps, if we went and advertise them online, would be a really effective way to reach people potentially in higher income countries, right? Or maybe reach people in the higher portion of the income distribution. But does it work for impacting children below a certain poverty threshold, right? That's really the question. And so that's a question we can directly try and answer by targeting those people who are below a certain poverty threshold directly using these tools. And once we do that, then we can actually try and measure, great, for that subpopulation of interest, what is the treatment effect on how we're moving their reading levels? What is the cost to get an app into their hands? This is our research agenda here for working with these literacy apps and working with Kids Learning, who made those apps that Ericka presented, which is, does it work, right? For how much money can we reach a child below a certain poverty line and move them how many reading levels? So does it work? Implicit here, it could be that we move them 0 levels. It could be that this is infinity dollars, right? An infinity amount. The first is it feasible? And can we measure the costs? And the second is, does it scale, right? Give me a region with a certain population. How many of them can we reach via these online methods, right? And in particular, again, how many of them below a certain poverty level can we reach to move a certain amount of reading levels? And then addition to this, an interesting piece of work that pops out of it, but that's really relevant when we think about doing these interventions online, is how do we measure poverty online? Another thing we're working on is actually developing an online survey that works both for low literacy populations and potentially for children. We can actually try and get a measure, an accurate measure that correlates very highly with traditional poverty measures for people who are using apps connected online and for whom we cannot do a face-to-face interview with. So that's our agenda.
Thanks, Nandan. Well, thanks all 3 researchers. So everyone has heard about some of the latest research on using behavior change communications for television, radio, social media, community events. Now we're going to hear from the producers and implementers, right? Those who produce the secret sauce of a lot of this edutainment and innovative behavior change communications, which are very prevalent, or aren't very prevalent, but they're most prevalent in health. And we have like the leading think tank from Hopkins working in the area, but they're much less common in education. And the goal of this session in a way is to inspire, excite some of the education development partners in investing more strategically, more systematically on innovative behavior change communications for their EdTech approaches. So we're gonna start with Poonam, followed by Regan, and then you close, Oluwakemi. Over to you, Poonam.
Thank you. Are my slides going to be? Yeah, lovely. So Population Foundation of India, and I'm going to refer to us as PFI, we use innovative and entertainment communication to transform regressive social norms, which are deeply entrenched in our community's behavior. Fundamental to our approach is the understanding that behavior does not occur in vacuum, and it is grounded in regressive social norms and customs. And what our approach and design of the program from the very beginning is: do it well, get the best directors from Bollywood, produce, invest money in production and research, both formative research, and we did a lot of positive deviance studies, but do it at scale. Can we go to the next slide? But do whatever we have designed and thought of doing. The medium used is always scale. And so everything is from a lens of a scaling up framework that PFI developed long before we thought we'll do behavior change communication. Our social and behavior change communication strategy is evidence-based, bottom-up approach that uses communication to reach both young men and women. And, a name like I, A Woman Can Achieve Anything, our program, our entertainment education program, we were expecting, maybe 10%, 20% men will see it. But the design is done in a way to attract more men. And we were very happy when we found all through the 3 seasons, 180 episodes, that 48% men were watching and 40% of them were young people. So a 360-degree approach is what we used, using digital platforms, on-ground outreach, mass media and community media to amplify and disseminate the messages to the widest possible audience at scale. Can we go to the next slide? So in India, women compared to men face huge number of disadvantages. I have listed just a few, and when I say disadvantages, the gap is huge. For instance, malnutrition, anemia. Close to 60% of women in India are undernourished and suffer from anemia. Child trafficking is rampant, and only 8% of women are in the have job opportunities in the formal economy. 20% are in the formal economy, and 80% are in the non-formal sector. And there are huge mental health issues, and violence is more than 50% women experience violence, but also domestic and all forms of violence. And it is legitimized by both men and women in a patriarchal society that we live in. Addressing these challenges faced by women requires recognition of the very complex factors that enable them. While the roots of several of the above mentioned issues vary across the country, cultural norms and stereotypes perpetuate across the country inequality. PFI uses, as I said, SBCC across its programs to challenge the norms, the regressive norms, and transform mindsets. Can we go to the next slide? One of our first programs that I want to share very quickly, we have a whole range of programs there, and I'm going to spend literally a couple of bullets on each. But Main Kuch Bhi Kar Sakti Ho, A Woman Can Achieve Anything, was designed as an entertainment education intervention with a soap opera at the core of what we do. Main Kuch Bhi Kar Sakti Ho, A Woman Can Achieve Anything also focuses on empowerment, inclusive behaviors at individual, family, community, and system level. The second program, Satya, that you see, the first one that you see on the right-hand side, Main Kuch Bhi Kar Sakti, introduced Satya, and it was introduced by the main program Main Kuch Bhi Kar Sakti Hu for 800,000 volunteers who were appointed at the community level. Each village had 2 peer educators. Each village is supposed to have 2 peer educators. We've only appointed 200,000 yet, and meaning the government hasn't appointed 200,000. And these peer educators are selected by the community and trained to act as support systems for their friends and fellows. The name Satya, which means friend, companion, was inspired by the Health Ministry, the National Health Ministry, and the comprehensive toolkit was developed by the government to promote, to promote the national program called Rashtriya Kishori Swasthya Karyakram, which is a program with 800,000 peer educators and frontline workers in the country.
1 minute.
What we developed is the toolkit. Third, another program which we included celebrities in a big way is called the Bas Bahut Ho Gaya campaign, which was a campaign on ending violence against women. And the campaign reached 4.2 million viewers online every month, and the campaign ran for more than a year. 6 short films, 3 with non-celebrities and 3 with celebrities, and well-known celebrities and sports people, journalists were part of the campaign. A digital film context was promoted in 600 colleges across the country, where they made 2-minute short films and got awards by a jury selected among some of the leading Indian celebrities in the film industry. A celebrity support from the campaign was showcased at a concert in Mumbai, which was led by Farhan Akhtar, one of our key partners, who is a leading celebrity in India. And the concert was a live event and was watched on Facebook when we launched our campaign by 4.8 million viewers. In fact, we were trending number 2 till early hours of the morning. And for the first 3 hours, we were trending first globally. A video anthem for the campaign was also done by one of India's leading lyricists, Javed Akhtar, and was released on March 8, 2018 on the occasion of International Women's Day. Sex Ki Adalat, which is something that has been evaluated by Victor and his colleagues in the World Bank, is a 5-episode series which discussed critical issues related to sexual and reproductive health, but mainly sexual issues around sex and sexuality, which are taboos in schools, colleges, and any formal place. So digital space was a great space for us to go. It garnered a viewership of 1.7 million, eventually leading to up to more than 5 million. Can we go to the next slide?
Poonam, if you could wrap up in the next 30-40 seconds, greatly appreciate it.
Okay.
Thanks.
Okay, so I'm just going to give you the scale of Main Kuch Bhi Kar Sakti Hu. We reached more than 1.5 million viewers over 3 seasons with 83 episodes. Next slide, please. The series was broadcast on India's broadcasting channel, Doordarshan, and it also adapted radio and 200 radio stations. The interactive voice response system had 1.7 million calls from 400,000 unique callers. Can we go to slide 5? In season 3, Main Kuch Bhi Kar Sakti Hu introduced an AI-powered chatbot, and the chatbot has had 1 million conversations within a month of its launch. And finally, slide 6, over the last 18 months, PFI has rolled out a series of campaigns for COVID-19, and the content created by Population Foundation of India, disseminated in partnership with the government's page called MyGov and citizens across the country, including NGOs across the country, have used our material for COVID appropriate behaviors. Thank you.
Very, very interesting, Poonam. Thank you so much. Oluwakemi, to you.
Oh, is it, Victor, is it my turn or is it?
Sorry, Regan, my apologies.
No worries. Hi, everyone. I'm Regan Alsup, Director of Production and Media Strategy for Impact Ed International. I've been tasked today with talking about the linkages between social behavior change communication and in-school instruction. And that's really sort of where we started as an organization 20 years ago, using educational media to bring learning to life. Creating content on everything from math to malaria to Mars, and pairing it with sustainable technology. Our flagship program really is producing content, training teachers in how to use it on everything from gender responsive pedagogy, 21st century skills, and then working with governments to map it to the curriculum, making sure that content reflects the local, regional, and national education goals. And those pieces really cover the classroom learning, the in-school instruction. But we quickly realized that those pieces really only solve part of the problem. If students aren't in school, if they don't believe in themselves and believe in their ability to learn, then we're only addressing one part of the greater whole. So those two pieces, the attendance piece and the growth mindset piece, as we often refer to it, are really important, especially in the context in which we work. And this is where the sort of social behavior change communication and media for social impact piece of it comes in. On the one side, with attendance, that requires an enabling environment where students' basic needs are being met. Parents believe in the importance of educating their children, and other barriers like child labor, early pregnancy, and early marriage are avoided. And in terms of growth mindset, students and their parents need to understand the role they play in creating their own success. It's not fixed. It's not something you're born with or without. So Impact Ed as an organization believes in, and as we've seen, the research and evidence supports the power of social behavior change communication. And to us, that means the power, or can mean the power, of using a surrogate, exploring issues through fictional or real life individuals that reflect what the audience is thinking, what they're wondering, questioning, exploring, but sort of one step removed from the audience themselves. So we've used the power of the surrogate and media for social impact for years, starting with a program called Discovery Plus, which was a magazine-style TV chat show that subtly influenced the dialogue surrounding girls' education by using celebrity stories and inspirational biographies, highlighting stories of success in Ghana, Kenya, and Nigeria. And to fictional films, scripted dramas addressing health issues like tuberculosis and HIV, most recently challenging toxic masculinity and gender-based violence as underlying barriers preventing women from succeeding. And also recently with My Better World, our sort of blend of animation and documentary stories, which were the aspirational movies used in the study that Ericka was speaking about earlier, and blend really the lives of 6 animated characters and their daily struggles with real life stories of success aimed at imparting aspiration, growth mindset, and life skills to young people, and also helping parents understand their role in developing an enabling environment to help their students succeed. Given the focus of this session, instead of telling, I want to use My Better World to show you an example. As quick background, Abby is one of the main characters in My Better World, who has an arranged marriage that threatens her ability to continue her education. And in the video I'm about to show, you'll see how Abby's story, shared in a youth club in northern Nigeria, had a real life impact on the life of a young girl. So let me just share this quickly.
Ina shekara 13 lokacin aka ce za a min aure. Tun gare da an yi aure na bara a bani ci gaba da karatu ba.
Kwarai mu nan yankin akwai yawaitar auren wuri. Kungiyar 'ya'ya mata kungiya ce da ake taruwa iya yara mata. Na farko dai ina sa musu plate din nan na By Better World, shine duk wani darasi da kowanne episode yake koyarwa. Tunda in dai mutum ya dauka gaskiya zai masa amfani a rayuwar shi.
Abby's friends are very worried about her. And to be honest, so am I. Mama, I am sure you know that early marriage is dangerous for a young woman.
Labarin aurewar gaskiya ya sani kuna dai kuma fahimci abubuwa da dama a kansa, kamar dai auren wuri da yara bai da amfani, kamar kuma haɗin kai na ɗalibai.
Ta zo ta mun magana akan za a yi mata aure. Ita kuma gaskiya tana da burin ta yi karatu. Na samu iyayenta mun yi magana da su, shikenan sun yarda sun amince za su bata ta yi karatun ta an fasa mata auren.
Ina matakin GS1 kuma daga primary muka zana jarabawa muka tafi secondary.
So I think that Halima's story really showcases the ecosystem that needs to be in place in order for students and especially young girls to succeed. And I think I'll just sort of close by saying that there really is no silver bullet. Success, at least from our experience, success in education is made up of a lot of pillars that all must be present. Our educational media is great as an in-school instruction tool, can be used to support learning gains on any number of topics, from literacy and numeracy to life skills, social emotional learning, but only in the hands of a trained teacher who knows how to use it and who has access to the right technology. And importantly, only if students are in school, which requires that community buy-in, and also believe that they can seed through social emotional learning and a growth mindset. Students need to be in school and ready to learn. And to us, that's really where we see the power of media for social impact and its linkage with in-school instruction. So I'll stop there.
Thanks so much, Regan. Interesting to see how the secret sauce is made for edutainment to work. And as you point out, it's not only the content, but it's an enabling environment in school, at home, etc., that makes a difference. Now we're gonna go to Oluwakemi. As I mentioned earlier, Johns Hopkins Communications Program is a leading program, or the leading program, on using behavior change communications in development. A lot of the portfolio is concentrated in health, but they have very cool toolkits, because often I feel that evidence alone is not going to convince policymakers, right? Having some TORs, having some basic understanding of what's high quality edutainment, who are some good vendors they can approach, and other questions on the hiring and selection and implementation of these campaigns are very important for task team leaders to decide to invest in new approaches, including communication. So over to you, Oluwakemi, and we will have a few extra minutes after our session for maybe a couple of questions. Oluwakemi, to you.
Okay. Hi, everyone. So the focus of my presentation is going to be on the priority that Johns Hopkins CCP places on fostering SBC capacity. Okay. Next slide. Okay. So as has been mentioned, Johns Hopkins CCP is a world leader in health communication design, implementation, research, and evaluation. And CCP has been working in this space for over 30 years, working to implement and scale social and behavioral change across the globe. One of the key learnings from all these years of experience is that for successful scaling of social and behavioral change interventions in any sector, we require practitioners have relevant expertise and capacity to be able to carry out these interventions. Next slide, please. Because of this knowledge, CCP has invested a lot in fostering the expertise required to achieve strengthened SBC capacity. So the way CCP works, CCP ensures that stakeholders we engage with also have SBC capacity. So it isn't just domiciled with CCP, but as we engage communities, as we engage ministries of health, we work to ensure that their own capacity is built, their own capacity is strengthened. So even after projects have ended or we have pulled back a bit, they are still going to be able to carry on and make SBC a priority in their programs and in their initiatives. And one of the ways CCPs invest in SBC capacity is through various digital resources and platforms which foster SBC expertise. So there are a number of platforms that CCP has established. These are some examples. We have the COVID Communication Network, which focuses on building the capacity of SBC professionals for the response to COVID. We have Compass, which I'm going to talk about briefly, which is basically a curated collection of resources for SBC practitioners across various sectors. We have the Rwanda Compass, which is like the global compass, but is focused on the Rwanda space. And then we have Springboard, which is a global community of SBC professionals. Next slide. So a bit more about the Compass. The Compass is an online collection of curated SBC resources. It was launched in 2013 and has grown to over 3,000 resources. The platform serves an essential role in strengthening the capacity of the global SBC community. It provides users with improved access to high-quality SBC resources and tools. And the Compass has been made possible through funding from the United States Agency for International Development. Next slide, please. Okay, so we've been able to grow a lot and we have quite a global reach. So we have over 200,000 users who access materials on the Compass on an annual basis, and we have over 50,000 downloads annually. We have our materials organized in various formats to cater to the various needs of SBC practitioners. So some of these include how-to guides, trending topics, spotlights, SBC project materials, and resources. And the great thing about this is that even though we work in the CCP, in the health sector, a lot of these materials on the Compass are cross-cutting and can be used by SBC practitioners in any sector. Thank you.
Thank you so much, Oluwakemi. So I believe we have 10 extra minutes for questions. Thanks for the M-Education Alliance for extending our time a little bit. I see several of the questions have been answered already in the chat. So we have a few questions prepared for our panelists. Let me start with you, Rachel. So the Global Education Evidence Advisory Panel, which I understand you're part of, recently concluded that investing in laptops, tablets, and other hardware alone was a bad investment. Can innovative behavior change communications be one of these missing components, as the title suggested of this session?
Yeah, so thanks. So the Global Education Evidence Advisory Panel, GEEP, sort of looks at all the evidence that exists and says what is the most cost effective. And that while we said that providing hardware was not cost effective, and there are multiple studies suggesting that, we did highlight that that technology that helps teachers adapt to the level of the child can be very cost effective. So you can do, I guess my sense is that rather than saying, oh, we've got a technology, what do we do with it? You say, what do we know is effective in improving education? Is technology something that is behavior change? Is that a way that is, useful to delivering? And I think one of the things that technology is very effective at doing is differentiating, right? Is providing different messages to different people. Tailoring is something that's quite good at, and we heard sort of the targeting and Facebook approach. You can really target using a lot of data. So, and we know that in education, it's really important to target to the level of the child. So that is, that's one way that I think it's important. But I think it's also, we know that there are misconceptions. So you've heard about some of them here about, people's aspirations, but also what they, the mindset. We know from, all micro studies that that's important. So then the question is, taking those and then thinking about how you can do them at scale, and where technology is the right answer, and where edutainment is the right answer to get those out. So I think it's about analyzing the problem on the ground, knowing what rigorous studies have said is the most effective, and then what's the right mechanism to get it out. But one thing we know is these sort of, using media, mass media or social media is an incredibly cost-effective way of getting messages out. But we also know you have to do it really well. Like, you have to do it right. And that's what the data says.
Thanks so much, Rachel. My bad. We have a hard stop right now at 11:31, not 11:40. My apologies. So just to thank then all of our panelists and attendees for this very interesting session. So thanks, and see you in another session. Ciao.
Thanks, Victor. Thanks all.
Thank you.